that empowers. We are committed to creating and sharing knowledge that empowers children and young people to understand the steps they can take to reduce their risks, increase their resilience to mental health problems, and improve their mental health.
Our vision is to create a world with a sound mental health for all.
People do attempt suicide.
Naturally, people are born to judge, but judging and expressing the judgment is something that we can preserve for ourselves.
We find that suicide bereavement is even more difficult than losing someone through natural death.
Be empathetic in the way you approach their situation, because if you show too much sympathy, they will also start feeling guilty.
Greetings to you all. Welcome to our show, Tap In. Hello, everyone. Welcome to our show. I'm Julian Tambara, your host. This week, we're going to discuss about COVID-19 and mental health. So to start our discussion, we are going to discuss about family and spirituality, and uncertainty caused by COVID-19. So today in the studio, we have our guests, and they are going to introduce themselves. So I'll start from my left-hand side.
Thank you very much, Tawanda. My name is Nyara. I'm a family therapist and counselor, and would like to see how or discuss about how the family has been impacted by COVID-19.
My name is Ursula. My profession is in the medical. I'm a nurse anesthetist, but I'm also a hospital chaplain, and I work in spiritual care.
Okay, and we also have a guest online. Can you please introduce yourself?
Morning, Tawanda. My name is Julian Tambara. I'm a clinical psychologist based in Gweru and a senior lecturer at Midland State University.
Okay, thank you. So today we're going to discuss about COVID-related stress. We're going to tackle family, spirituality, and uncertainty. So before we start, Dr. Tambara, can you define what is COVID-19 related stress?
Thank you very much, Tawanda. As you are all aware, as long as you live on this earth, you are aware of COVID-19, the pandemic that started in China and is now spread world over. And for people in Zimbabwe, we have been with the pandemic for more than 2 years. We had our first case in Zimbabwe in March 2020, and we are almost getting to 2 years with the pandemic. So the pandemic on its own brings in a lot of stressors, and stressors that are related to the pandemic are various, they are numerous. And part of the requirements or the protocols for managing COVID bring in a lot of anxieties. For example, the social, we want to call it the physical distancing. It results in a lot of isolation where people cannot visit each other and they cannot get the support that they want, and they end up getting stressed. We also have health workers becoming stressed because there are more people getting ill. There are more deaths that are being reported countrywide. So it's a lot of things happening, Tawanda, during this period of COVID. It's a lot of stresses.
Okay, thank you. Now, we want also to understand the issue of family. What is family?
Okay. Family is a group of people united by marriage, by blood, or by adoption, living in a single household. When we look at families, we also don't leave out organization. As people gather together, they also become a family within the organization. So as families and organization, COVID-19 had a very huge impact, because usually we wake up as families, we start doing our errands. One goes to school, one goes to work. At the end, everybody had to be closed in, including organizations, which have also become a part of a family because people have been living together as they are working. So COVID-19 had a serious negative impact on the way the system itself was constructed before and how it is now. We're having people having to work from home, people have to stay at home, and some not even going out at all. So as a unit, it had a serious negative impact.
Okay, thank you. Now, Ursula, you said that you are a spiritual care, right? So what is spirituality?
There is no clear definition of spirituality. So I give my own one.
Okay.
For me, spirituality is the expression of what you believe. How do you give meaning to your life? And that will be expressed in your life. Like if you believe that there is only you and there is nothing else, and there is no superior being, there is nothing beyond what you can see, then maybe your spirituality will be seen in the way you deal with material things, the way you deal with creation.
Okay.
If you believe in a superior being, and that being is stable, unchangeable, loving, caring, then your spirituality might express itself in the way you want to connect to that spiritual being and that higher being. If you believe in ancestors and spirits, your spirituality will be shown in the way you try to connect to ancestors and spirits.
Okay.
So for different people, it's expressed differently.
Okay, so you're saying spirituality is more of a belief. So everyone is a belief.
I would say spirituality is the expression, what you see.
Okay.
It's the result of what you believe.
The result of what you believe, and everyone is somehow believe in something.
Everyone needs to give meaning to his life, and I think that would be their belief.
Okay. All right. Thank you. So now, what is the role of family when dealing with COVID-19 related stress?
Because as family, we are there for each other. It's a system. We are interacting in the system and being there for each other, be it financially, emotional. As a unit, we need to be there for each other. So the role of the family, it brought in a lot of uncertainties. People were not aware. People did not have enough information. People were getting sick. People were dying. So as a family, people need to be together in order to combat COVID-19. There was a lot of bereavement. Like the speaker is saying, Ashla, we were used to being there as a family when somebody gets sick, but now we couldn't be there because of how COVID was spreading. So it brought in a lot of tension and a lot of emotional breakdown for people within the setup as they got sick, and the caregivers as well. One was isolated, and yet in a normal setting, people would visit, bring food, come and sit and offer emotional support to the caregiver and to the patient. But this is something that was just torn apart. You couldn't be there for each other as how we usually be there within a normal functioning family system. So it brought in a lot of anxieties, a lot of tension, a lot of breakdowns in terms of mental health. It was just something that.
So you're saying the role of family is for being there for each other.
Being there for each other and looking out for each other, providing for each other, be it financially, emotionally, something that was just cut off.
All right.
Yes.
All right. Doc, are there any tips that family members should do maybe to take care of other family members?
Okay, thank you very much, Tawanda. Okay, thank you. The family is the primary support system, and we all get our support from the family members initially before we look for help elsewhere. So it's critical that the family is available. I recommend that people check on each other. We are all living in a crisis. Everyone is trying to make ends meet. We are all struggling emotionally, but I encourage people to check on each other through maybe WhatsApp messages, through phoning each other. We know that sometimes gatherings are not allowed, but let's keep the connection one way or the other. Let's keep the connection, and also let's understand how our loved ones are doing. We have our relatives in rural areas. How are they doing? Some people from our families were affected financially. What is it that they need? What help can we give them? I recommend that we should always be there for our loved ones. And also as a family, there are some groups of family members that are often forgotten. Children, let's keep calm and not panic for the sake of the children. Let's check on our children. How are they doing? And let's check on what they have heard about COVID-19. At one point, I asked my son, who is 9 years old, what he has heard about COVID-19, and said, I heard that by end of 2020, everyone would have died. And I had to help him, okay, this is what is happening. These are the statistics. So children are usually neglected, and they get news from elsewhere, and they become very anxious, and that affects them. So another group that we need to take care of as a family is the elderly. This group is also one that is neglected. You find that the elderly people are in the 60s, 70s, 80s, 90s. With COVID, they are said to be more vulnerable. And remember, since they were born, they'd never come across a pandemic. So for them, it's a lot of adjustment that needs to be done. It's a lot of anxieties as well, but those groups are usually forgotten. Over to you, Tawanda.
Okay, thank you. So you highlighted that family is, we should keep on communicating and checking on, especially on our kids, to make sure that they have the right information about COVID-19. So now I want to ask you, Ursula, about what are the roles of spirituality when it comes to helping someone to deal with COVID-19 related stress?
So if you were talking about the importance of family, like what you can do, let's say for funerals, if not everyone is invited or not everyone can join the funeral, what we used to do is to light candles. Also to light candles as a symbol for all the people who would like to be there but not be there.
Okay.
And then just symbolic, have them in a community with all the people who are grieving. Or people in hospital, if you cannot go and visit them, you could, what I saw were families who made a big poster and they put different pictures of members of the family, and they would write the names and just a greeting and say, we remember you, we pray for you. For me, spirituality or COVID was when people are isolated, they actually start to think and reflect about values, about meaning, and sometimes it helps them to put new priorities and the right priorities. And it can actually even get to the point that relationships within the family are healed. So that would be the role of a spiritual care person, to address these issues and to accompany people while they are in hospital and isolated.
So how can you help someone who view COVID-19 as a punishment?
As what?
As a punishment. Someone, a family member would view COVID-19 as a punishment from God, maybe, or from whatever they may believe in.
It depends what picture you have of God. If you believe God is caring and loving, if you see a parent who punishes his child, then you need that parent wants something good for that child. He wants that child to realize that it has gone the wrong way, or that he needs to do something differently. So if you believe that this is a punishment from God, then maybe it will help you to reflect upon your own life and to think, are there things I need to change? Have I gone the wrong way?
Yeah.
If you can't find anything, then maybe it's not a punishment from God.
But a lot of people are saying it's a punishment, especially those who are religious. They're saying God is angry, maybe He wants to communicate some message with us. So how best can we help those people?
I would ask them, so are you aware of something that you have done wrong, that you deserve punishment? If they can't think of anything, then I wouldn't think God is punishing them.
Okay.
And also, if they believe in the God of the Bible, then God is not depicted as someone who is accusing. It's actually Satan who is the one who accuses. I think God is there to forgive and to restore and to heal,
Okay.
and not to destroy.
All right. Okay. Now I'm going to ask you the same question, but now not with a biblical perspective, but from a therapy, from a psychologist or counselor perspective. How can you help someone, a family member, who view COVID-19 as a sort of maybe a punishment or as a sort of a curse?
It's very important to first understand their belief system. What is it that they believe in? What is it that they think they could be getting punished for? Then we take it up from there, because it's difficult for us to post that God is punishing you, and then what if they don't believe in God? So it's best to understand their issues of spirituality in terms of a family. What is it that they believe in? Some might think that it's their ancestors punishing them because they believe in ancestral spirit. Some might think that it is actually God, but it's the relationship that they have with God. Like the other speaker is saying, what is it that you think you might be being punished for? So it's important as therapists to understand the family's spirituality, what they believe in, and what rituals they perform, or what they do when they're faced with such issues, and then we go along with that.
Okay. Dr. Tambara, do you have anything to add on, especially on helping those people who view COVID-19 as a curse or as a punishment, maybe from whatever the spiritual kind of world they believe in? Okay, unfortunately, she's out. Okay, now, we understand that I think Dr. Tambara mentioned that COVID-19 has brought a lot of uncertainty into our lives. So what are those uncertainty, and do you have any specific uncertainty that will bring out by COVID-19? Maybe I'll ask you, Isla.
What I realize here is that many people are unsure whether they should trust science. Should they trust what the doctors say? Should they trust the people who developed the medication, the vaccine? Who brought it all? How did COVID enter this world? Why did it come? Was it purposefully? Was it an accident? Has someone hidden agenda? I think this is a lot of insecurity and uncertainty, and it makes people fearful, and people are just unsure what they should do.
Okay. All right. Do you have anything to add?
I must say it has brought a lot of uncertainties because people don't even know what the future holds. You can't even plan for tomorrow because you don't know what tomorrow holds. A lot of people have lost their jobs. Like schools, people haven't been going to school. We don't even know whether we should plan for the next term. So it has been a very difficult moment for everyone to plan, and the emotional breakdowns, and it's very uncertain. Now we are hearing there are other variants that are coming, so we don't even know what to expect. But all we can say is that people should remain hopeful, and they should just not listen to everything that everybody is saying. It's important to take note of information from trusted social media or from people who have the correct information, so that we reduce the uncertain issues.
Okay, thank you. I think we just lost Dr. Tambara. She was supposed to highlight issues to do with uncertainty. So, okay, so how then one can manage the uncertainty?
Then again, it depends what your belief system is. If you believe that God is unchangeable, that He remains the same from eternity, then that is the stability you have. And you can trust that He's still in control, whatever happens, and that He can protect you from, that He will be with you wherever you go and whatever happens. It also depends about how you explain religion. If you think that you have to follow a certain way and then God blesses you, and if something bad happens, that means it's a punishment, then that will give you more insecurity and uncertainty. But if you know that we are just humans and we can't understand God, but we can trust in Him being stable, being loving, being caring, being unpowerful, whatever happens, then that will change your sense of security and your sense of not being alone and being whole in something greater.
Okay.
I think as families, it's important to come together and discuss on issues of uncertainty together as a family, so that you are able to plan and see how you can move on from where we are today and involve everybody, including the kids, like Dr. was saying, that you need to involve everyone so that we reduce the anxieties. Then we know what plans we have for tomorrow and what plans we have for the future as a family, as a unit, and as a system.
Okay. Are there any spiritual tools and tips that can be used to help someone to manage the uncertainty?
I think even before we come to spiritual tools, it's what you said before. Decide which sources you trust, which sources of information. I personally think just follow the WHO guidelines. Listen what they say. Don't listen to everyone else who also has another opinion. And then spiritual tools, it depends where you get your strength from. Where do you get meaning from? For some people, they connect with the transcendence by being in nature. You can do that even during COVID. You can go out, you can walk, you can connect with what you see around you. Even during COVID, you can connect with some family members. You can maybe go for a walk, two of you, and talk. Or you can have a WhatsApp call or a phone call. Just, think about what gives me strength, what helps me, and then focus on that. And try to find a way how you can put that in action even during COVID. And then there are lots of online resources. Like if you are a person who likes to meditate or listen to sermons or messages, you can just Google, you write, maybe the name of your religion, and then you write meditation, or you write sermon or prayer, and then a lot of things will pop up to help you.
Hello, Doc.
Yes, Tawanda?
Okay, I asked you a question about how can you help someone who view COVID-19 as a punishment. Let's say those who view COVID-19 as a case and they maybe come to you to seek counseling or something like that. How best can you help that person?
Okay, thank you very much. I would approach it starting with asking the person what they've done wrong. We all know that usually you get punished when you have done something wrong. So they need to explain to me what they've done wrong, and we'll try to work on it to find out if they are being punished, and try to enlighten them in terms of the fact that COVID-19 or the pandemic is not just affecting them alone, but it's affecting a number of other people. So even if they did something wrong, does it mean that everyone throughout the world has done something wrong? So that's how I will approach it in terms of trying to really find out where they feel they went wrong and why they feel they are being punished.
Okay, but biblically, it's like we are all sinners when it comes to biblically, and most of the things that are happening, someone can say that okay, we are all sinners, and because of what the youth are doing, and because of the immorality of our world nowadays, and because of there are a lot going on. So someone might say, we are all sinners. So I have done something wrong, and maybe I believe COVID-19 is a punishment. So I don't know how best can you help that person.
Okay, thank you very much, Tawanda. I know a bit of the Bible, but it's not my area of speciality, and I don't usually get into that arena as far as offering therapy is concerned. I don't use the religious approach. I acknowledge that people have different religions, they have different beliefs, and part of how I see it from a therapy, from a clinical psychology perspective, is people have these cognitive distortions. Usually, when we are going through things, when we are stressed, your mind, your brain distorts reality. You don't see things as they are. So part of my work will be educating my clients on cognitive distortions, and maybe them thinking that it's a punishment for sin could be a cognitive distortion, and also psycho-educating them on how, as human beings, we try to have meaning out of everything. We try to get we want everything to make sense, right? So part of my intervention will be trying to help them to accept things that don't make sense, because I think the problem, the main challenge, they will be trying to make sense out of what will be happening around them. So I guess that's the approach that I will use. Thank you.
Yeah, okay, thank you. Okay, so now what families can do together to help each other to do away with uncertainty?
May I come back to what?
No, what family can do together to
So
help
you don't want
themselves?
me to go back to what?
Yeah, you can go back.
If you say biblically, people would argue biblically, then I would say the punishment Jesus has carried the punishment.
Okay.
No, it's not on us to carry that.
Okay.
And God wants restoration. So even if you think it might be a result of our sin, but then what God wants is restoration and healing. So that would be my response.
Okay.
And families, I think what I already said before, we can support each other, we can call each other, we can maybe not visit each other as a whole group, but one-to-one we can meet if we keep the social distancing. We can ask each other how we are. We can pray for each other. We can ask the other one what helps you in this situation. Maybe that person likes to sing, and send him a song. There are lots of things you can do.
Okay.
Yes, for most families, sometimes it's said not to be okay, to be not okay. But at times it's okay not to be okay. So you have to find somebody that you can talk to, somebody that you can trust, somebody that you can share your feelings, your emotions, then you can discuss and get help. And also it's important to notice different behaviors in people so that you can pick out the anxieties and distress in people. They like talking too much and all of a sudden they're withdrawn. It's just basic to ask if somebody is okay and if they need any help, be it financially or emotionally. So yeah, just being there for each other.
Okay. So I was thinking you were going to mention something to do with you should pray together as family. Should create those times in morning, the evening for families to pray together. And also what about those activities? The little activities, especially gardening, even cooking. As a family together to motivate morale and also to motivate the spirit. Doc, do you have anything to add on what family can do together?
Okay, thank you very much, Tawanda. Families can work together in terms of establishing routines like, okay, maybe things like exercising together, as you said, maybe cooking together. Remember, we also are not changing the status quo. If your dad was not in the habit of cooking, you can't say, okay, come here, let's cook because it's COVID. We want to acknowledge what has been there before and how you have been coping and trying to modify it. Remember, children are spending more time at home because schools have been closed for a long time. How do they feel in that time? It means there's a lot of gaps in terms of time and there's a lot of idleness. So I recommend our usual activities, the ones that we used to do as a family, and we different families have different ways of passing time. Also, having new hobbies helps a lot. Starting something new, as you said, gardening as a family, maybe learning a certain skill together as a family. It also helps to bring the family together.
Okay, so I think we just come to an end of our show. Before we close, do you have anything that you can add on to the summation of all the presentation? Anything that you can let our viewers know?
Would also like to let the viewers know that we are also there for some other families. You know, we're talking mainly about a functional family, but there are also families that are dysfunctional and they might need our help during this time where people are locked in together and probably they don't get along together. Please don't hesitate to look for help, to find somebody you can talk to, because a lot of GBV has also been on the increase, and when we thought that family should be sticking up for each other and looking out for each other and the togetherness that we are talking about. So for those families that have not been able to do that or that are not able to do that, please know that we are here for you. If they need any help, if they need anybody to talk to, if they need the issues of spirituality, whatever they feel that they need us to discuss with them, just to let them know that we are here for them.
Okay, do you have anything to add?
Yeah, I think COVID-19 is a big chance. It helps each one of us to ask us questions about the meaning of life. Whom do I trust? Is there something I can trust or someone I can trust besides myself? What is important to me? As we said, family, relationships. Is there anything I have to repair? Anything I have to talk about with someone? Do I need forgiveness? Do I need to ask for forgiveness? I think it could be a big chance for healing and restoration in the family also.
Okay, thank you. Doc, do you have anything?
Thank you very much, Tawanda. My take-home message that I want to give to everyone is that remember, you're not alone. It's billions of people across the world who are experiencing COVID-19 related stress. It's a lot of families that are struggling. Take note that you are not alone and don't abnormalize everything. If you are feeling anxious, if you are feeling sad sometimes, if you are hopeless sometimes, it's a normal reaction to what we're experiencing. It's a normal reaction to struggle during the pandemic period, but you may want to just check out if that continues for a long time and you may have to seek help. But above everything else, believe in yourself. Don't set goals that are too high, because this is that you make, and celebrate the small things. That's my last message, Tawanda.
Okay, thank you so much, Nyarazo, and thank you so much, Ursula, and thank you, Dr. Tambara, for being with us today. And to our viewers, thank you for watching. We discussed issues to do with COVID-19 and mental health, focusing on family and spirituality and also uncertainty, what families can do together to help each other to cope with COVID-19 related stress, and also the issue of spirituality. How can it help also an individual to cope with COVID-19 related stress? Also discussed about uncertainty, what is uncertainty and how to deal away with uncertainty. So thank you so much for watching. and stay tuned. This is our show. Check in. Stay tuned for next week.